Saturday into Sunday right now, but not a washout weekend. We'll keep you posted. Back to you.
So much. Well, there is traditionally a kind of shifting of staff after each election cycle, but the exodus of GOP healthcare staff may point to a deeper issue. Politico healthcare reporter Paige Winfield Cunningham joins us today with more on that. Hi, Paige.
Great to be on.
So, would you say this is a brain drain going on? And how serious? What are the numbers?
Well, if you want to see how frustrated Republicans are with health care, all you have to do is look at their staffs. Over the last couple of months, I was noticing how many top health policy staffers seem to be leaving for consulting jobs. And I think you're right. There's going to be a real dearth of health care knowledge on the Hill among Republicans.
So these are higher level people?
These are high-level staffers. In fact, they're people that were here by the side of Republicans as they were working on the big health care law a couple of years ago. And I think frustration has really been mounting for them because they were there as Republicans were kind of cut out of the health care law process. They watched the law pass. They watched their bosses try over and over again to repeal it, continually fail at that. And then, of course, there's the issue of entitlement reform. These top folks have worked for a long time on ideas to reform Medicare, Medicaid. This year they were hoping to get some reform. Now the chances for that seem less than ever. So it's sort of this just mounting frustration that you kind of see.
Is there some place they're all going, or different jobs, or what?
Kind of like many policy staffers who, work long hours on the Hill. These folks are going to consulting firms, lobbying firms that promise better pay and fewer hours. They kind of feel like they've put in their time. And it should be noted that, some of this is kind of natural. After an election, you'll naturally have a shift of staff.
And you probably see that going on in some of the other departments as well.
Right, exactly. But what seemed to be notable about this was how many health policy staffers. There were a few Democratic staffers, but the top people on both Senate and Republican committees that know the health care law intimately were involved in all of this, most of them are gone now.
So do you think some of it is just sour grapes? The Democrats sort of prevailed on the health care issue, and the law became law. So, they feel like, well, my side didn't win, so adios? Well,
I think some of them are probably, some have actually told me that they're frustrated with their bosses because, some of them look at this realistically. Republicans need to work with Democrats now, but they've seen their bosses kind of give lip service to wanting to improve the law, and yet real steps aren't taken. And so I think, just practically speaking, a lot of them don't have nearly as much to do as they once did. So it's frustrating.
Maybe they'll have lots to do in their new jobs. Who knows? Paige Winfield.